significantly, much more aid must be allowed into Gaza, starting right away. Okay, right away is tomorrow morning, but as soon as possible.
Israel says it finally decided to allow this aid in to ensure no starvation crisis develops. Dr. Harris, is this too little, too late? We're already in a starvation crisis, aren't we?
That's correct. We're seeing hundreds of thousands of people who are starving and who are being starved. And they're being starved of more than just food. They're being starved of medical care. They're being starved of clean water. They're being starved of safety. They're being starved of mental health, of reassurance. Every night they are terrified. And the human mind is not geared to being in a constant state of terror.
Dr. Harris, getting in aid, of course, is tremendous. 5 trucks, hopefully it'll be more in the coming days. But how difficult is the distribution? How challenging is to get this aid to the people who need it most when Israel continues its attacks from the air and on the ground?
Indeed. Again, what we need to be able to distribute aid effectively everywhere to everyone who needs it is safety and security. So it's not simply a matter of bringing trucks in, just as you quite rightly say, but to be able to bring them everywhere and to know that the people bringing them in are safe, that they're not going to be bombed or shot. And that also, remember, you've got a population who are desperate. So we need to be able to do it safely and to ensure that the aid reaches the people who need it most urgently.
Well, you also talked about the healthcare system, which is in dire condition from Israel's earlier bombing campaign. Can you give us a sense of how these hospitals, the ones that are still functioning, how are they doing it with so limited life-saving resources and supplies?
It's quite extraordinary, and it really is down to the commitment of the healthcare workers who, honestly, as a healthcare worker myself, as a doctor, I cannot believe that they keep going. And I was going to say that they get up every day and do this, but actually half the time they don't even get sleep. Half the time they're working 24/7. And indeed, one of the biggest struggles and what they say to us all the time is they could do so much more, but they often don't even have the means to keep the floor clean, because they don't currently even have antiseptics or cleaning materials. They don't have swabs. They don't have Band-Aids. All the basic things that you will use to repair somebody's broken body or their illness is simply not there. So no matter how much expertise you have, even if you have a functioning hospital, and you're quite right, most of the hospitals are just shells of what they were before. Even if you had that, if you lack the equipment, you know what to do, but you can't do it.